Congresswoman Tlaib. Congresswoman Mike Thompson from California.
Thank you, Madam Chair, and thank you, the witnesses, for being here today. I want to just reiterate something that our colleague, Congressman Conaway from New Jersey, a doctor himself, said. He said when the Republicans take control of the Congress, the first thing they want to do is cut health care. I just want to point out that they've outdone themselves this time because they cut health care to give a huge tax cut to their billionaire buddies, people who don't need a tax cut in this environment. And for the past 3 weeks, Speaker Johnson has refused to call back his Republicans to this House to work at a time when people across the district, across the country, people from our district, 30,000 people from my district, are getting these notices from their insurance companies that their premiums are going to shoot through the roof. They open these letters and it's instant sticker shock. And the calls that I get to my office are why? Well, the why is pretty simple. It's because the congressional Republicans are on vacation. They need to be here in these chambers working with Democrats to make sure that we can mitigate these incredibly astronomical cuts that are increases that folks are going to see. In my district, a family of four making $129,000 will pay $14,444 more, a 161% increase. A 60-year-old couple making $82,000 a year will pay $23,788 more, a 526% increase. Nobody can afford that. Think about that. A 526% increase, 161% increase. These aren't just numbers, they're not statistics. These are things that are going to impact real people. It's going to hurt their ability to pay their mortgage, to buy their groceries, and it's going to impact their savings accounts. Savings accounts gone overnight because the Republican Party is not working with us to mitigate this problem. Heather, I have a question for you. You are a nurse who has experience working in rural areas. I have at home an incredibly wonderful wife who is a nurse working in rural areas. And I'd like to know your thoughts on two things that my wife, my district, and my constituents are facing right now. One is we just got word this week that one of the hospitals in an area that's already medically underserved has pulled back their plans to expand their facilities to be able to offer services to more people. And because the Republicans are on vacation and not here, we're not able to extend the telehealth coverage that Medicare patients are able to use in order to get their health care. And in rural areas, it's a double whammy for them because it's further that they have to travel. One constituent called me and said without telemedicine, she has to pay $100 each way for an Uber ride to get to her provider. Can you comment on that?
Initially, right, that's not sustainable. Like you can't expect someone to be spending $200 just to get to and from an appointment, right? So then they have the copay on top of it, and then whatever the actual treatment is that they're going for. And some of these patients don't have the luxury of time, right? So take, for example, someone who could potentially be having a seizure, right? They could get into their car and drive down the road and crash into you if they miss an appointment, or into anybody that's sitting in this room, or into any one of the Republicans that's on vacation right now. Everyone is at risk when people and their health are devalued and demoralized, right? So the hospitals that are staying open will see a deluge of patients. So hospitals that are already potentially understaffed and underfunded are going to crumble, right? Some hospitals right now are literally sitting on two tectonic plates that are just ready for that one good hit to knock it down. And this will do that to a litany of hospitals across the country. And it's not just going to hit rural or urban, it's going to hit them all, and it's going to hit hard.
Thank you very much. You know, what's happening here is pretty apocalyptic. This is going to hurt a lot of people. The answer is pretty clear. Mike Johnson can bring Republicans back and we can negotiate a response to this, a solution to this. Easier, the president of the United States can pick up the phone, make one phone call and end this.